So last week, the Democratic National Committee determined that it would not include recreational cannabis legalization as part of its political platform leading up to the election. They solidified that position when the DNC denied a proposal amendment from the congressional Democrats that would have changed this. It failed in a 50 to 106 vote that took place earlier this week. So the Democrats' official cannabis position is essentially the same one that presumptive nominee Joe Biden originally laid out, that the party platform would focus on decriminalizing low-level possession, designating cannabis as a Schedule II narcotic instead of a Schedule I, automatically expunging prior cannabis convictions and incarcerations, and endorsing research for cannabis as a chronic pain management alternative, and favoring states setting their own laws above those of the federal government. Presumptive Democratic presidential nominee Joe Biden said on Tuesday that criminal records for cannabis convictions represent a major systemic barrier to economic opportunity that's had a disproportionate impact on communities of color. The Biden campaign added to its website a plan for funding for improved criminal justice data infrastructure for states that would help automate the expungement of criminal records and cannabis offenses. While most states already have a process for people to request record expungements for cannabis offenses, it can be an arduous process that requires time, paperwork, and often the support of legal counsel that person may not be able to afford. As New Jersey voters await a referendum on legalizing recreational cannabis on their election ballot, a poll of New Jersey voters found that 68% of respondents either strongly or somewhat support legalizing cannabis in the state. The majority of participants in the survey also said they believed that legalization would reduce the size of the black market, will help the economy and create jobs, increase tax revenue for the state, make products safer through regulation, and save tax dollars on law enforcement. The House of Representatives is set to vote in the coming days on an amendment to protect all state, territory, and tribal cannabis programs from Justice Department interference after a committee advanced the measure on Tuesday. The amendment states that the Department of Justice cannot use its funds in order to enforce federal cannabis laws on states in which recreational or medicinal dispensaries are legal and protected. This is essentially an enforcement of the Cole Memorandum, put in place by the Obama administration in 2013, which sought to prioritize state cannabis rights by protecting dispensaries from federal authority raids and punishment. The Cole Memorandum was temporarily revoked by former Attorney General Jeff Sessions in 2018. Other cannabis-related measures will be voted on in the coming days in the House. That includes enforcing current medical cannabis protections, provisions that allow banks to service legal cannabis businesses without being penalized by the Treasury Department, and protecting universities and their research departments from losing funding for studying cannabis. Amid Oregon's IP44 proposal to decriminalize all low-level drug possession regardless of the substance reaching its state election ballot, the Oregon Criminal Justice Commission published a report projecting that drug arrests and convictions for Black Americans and Indigenous Americans in the state would decrease by 94% and 87% for Hispanics. The combination of funds saved by reducing arrests and incarcerations, as well as funds allocated from cannabis tax revenue, would add over $121 million to the state's Treatment and Recovery Services Fund throughout the period of 2021 to 2023. In the change of subject, the DEA implemented annual quotas for the amount of opioids that manufacturers are allowed to produce and capped the number of permitted opioid painkiller prescriptions that doctors are allowed to make in a well-intended effort to reduce overprescribing from doctors, which, in all fairness, is a key reason for today's opioid crisis. But it has left us with shortages of these painkillers for people who do legitimately need them. In response to the COVID-19 pandemic, the agency has had to increase this year's quota by 15% for manufacturer production to allow drug makers to respond to the pandemic-induced shortages. Intravenous opioids, including fentanyl, are valuable tools used for managing patients on ventilators, including general anesthesia for operations, and mitigating breakthrough pain from medical conditions including terminal cancer, for whom daily life may be unbearable without that kind of pain relief. Federal bankruptcy courts ruled that manufacturer OxyContin Purdue Pharma, which is undergoing bankruptcy proceedings and facing thousands of lawsuits for their central role in the current overdose crisis, must cap their future political contributions at a total of $125,000 and no more than $25,000 per singular candidate or organization until its bankruptcy proceedings are over. Purdue Pharma so far has donated $185,000 according to Open Secrets during the 2019 to 2020 donation cycle period. And switching gears, the beginning of the pandemic triggered the first increase in Medicaid enrollment since March of 2017. As of April, 72.3 million Americans have been enrolled in Medicaid, up from 71.5 million in March. Kentucky saw the largest boost in state Medicaid enrollment during that time of 7%. The boost is largely attributed to recent job losses that led to dropped health insurance coverage. This comes as roughly 5.5 million Americans who were on private health insurance plans lost that health insurance in the midst of the layoffs from the pandemic between February and May. Researchers at the University of Bath in England conducted a Phase 2A study to determine whether high doses of CBD can help those with cannabis use disorders reduce the frequency with which they use cannabis. While the study found that 200 milligram dosages was ineffective for this, both 400 and 800 milligram dosages did somewhat reduce cannabis dependence compared to placebo in terms of frequency of cannabis usage. However, the researchers did caution against medicating with commercial CBD products in these dosages, since those products only contain about 10 to 25 milligrams of CBD. This is the second study in July that came out exploring CBD as a means to help wean people off of addiction. 2 weeks ago, a review of 14 studies taken between 2014 and 2019 on using CBD to blunt cocaine dependence effects in animals showed that animals who were given CBD were less likely to self-administer cocaine on a consistent basis, did not exhibit levels of inhibition and anxiety caused by withdrawal, and reduced liver inflammation and damage that was caused by cocaine use. The scientists in this review urged for similar testing on humans. We're also currently on the lookout for new psychoactive substances entering the American drug market. A shipment of drugs that was seized on July 17th was found to contain the novel opioid Brorphine, which came in chemical analysis laboratory reports to be roughly 4 times the potency of heroin. And yesterday, that same lab came in chemical analysis confirmed that a shipment of drugs that was seized on July 7th contained the novel opioid Metonitazene. Its potency is similar to fentanyl when injected, but its potency also is reduced by 90% when taken orally. Its chemical structure most closely resembles that of isotretinoin, much of which was manufactured and shipped from America to Canada. The reason why this is important is that stay-at-home orders and economic downturn are driving up the prices of more mainstream drugs, such as cocaine and heroin, and is increasing demand for synthetic and more potent lab-made derivatives that we know far less about. Dealers are cutting more popular drugs with these new substances because they can be cheaply manufactured, but it's dangerous because there's no telling how powerful lab-made drugs can be, and we know far less about them. So when people get their drug supplies of what they assume to be heroin, any of these substances can also be in those drugs, creating almost a Russian roulette effect where a person no longer knows or really controls what they're putting into their bloodstream. While these new substances tend to be picked up by the DEA seizures in bulk shipments intercepted in the mail, we still have absolutely no idea how much of these other drugs are out there in the country in what are called pre-heroin supplies, because the vast majority of medical examiner offices do not test for these novel opioids in toxicology reports. So every time there's a new introduction of lab-made opioids or another drug that could get into drug supplies, it makes the outcome of that much more unpredictable for the people who use them. The South Carolina Department of Alcohol and Other Drug Abuse Services revealed the staggering extent to which calls to emergency medical services for suspected overdoses increased during the pandemic. The impact of stay-at-home orders and subsequent economic fallout and diminished addiction treatment resources was immediate. The month of March saw a 62% increase in overdose calls to EMS compared to February, and its current peak is May, is 210% higher than right before the pandemic started. We wanted to end this newscast by acknowledging that today is Congressional Representative and Civil Rights hero John Lewis's funeral. He penned a letter to the New York Times asking that it be published on the day of his funeral. His activism started at a young age. He preached his first public sermon when he was 15 years old. Mr. Lewis met Rosa Parks when he was 17 and Martin Luther King for the first time when he was 18. He organized sit-ins at segregated lunch counters in Nashville and took part in many other civil rights activities as part of the Nashville student movement. The Nashville sit-in movement was responsible for the desegregation of lunch counters in downtown Nashville. John Lewis was arrested and jailed many times in his nonviolent movement to desegregate the downtown area of the city. He was also one of the 13 original freedom riders from 1961. He was elected to serve as the congressional representative of Georgia's 5th District in 1987, a position he held up to 33 years until his passing of pancreatic cancer. If you have any questions, comments, or feedback, you can email us at alldrugnews@gmail.com or direct message us on Instagram at AllDrugNews. Thanks, guys. See you next time.